Hi guys, welcome back. In this video we shall be talking about the basic anatomy of the eye. I will try to draw and make you understand about the basic anatomy of the eye as simple as I can. But before we start, a quick disclaimer here, right? Alright, so we're going to start here with the basic anatomy of eye. Whenever we're talking about the anatomy of eye, remember there are 3 points, 1, 2, 3, right? Outer layer, middle layer, inner layer. These are the layers of the eye from outside to inside. The outer layer is known as the fibrous coat, that is the sclera, right? The middle layer is very vascular. This is the reason is vascular, to supply blood vessels to the retina, to supply nutrition. This is vascular. And the inner layer is actually the main thing is retina. Again, retina is divided into two parts, peripheral retina and central retina. Vascular layer. Now, whenever we are talking about the vascular layer, you have many things here. You have the ciliary body, you have the choroid, you have the uveal tissues, you have the iris. In sclera, what are we talking about? The outer layer. We're talking about the sclera, we're talking about the cornea, and we're talking about the limbus. Don't worry, we'll try to understand with the diagram. You can see I have some tracings here because I was practicing. Okay, no worries. So this is just a basic diagram. Please, I'm sorry if my diagram is not good. You're supposed to understand the concept, not actually look into my diagram. You can check out online. That is actually very good in online. You'll get a very good understanding. So I draw the eye somewhat like this. Okay, this is what I draw the eye. Now, whenever I draw the eye, you have to remember that there are some structures like this. This structure is actually known as the what? This is known as the iris. Remember, the color of iris only you are seeing as the color of your eyes. Cornea doesn't have any color. So this is your cornea. This is your iris. And the center one will be your pupil. Now, what is pupil? It's just like an aperture. It's allowing the light to enter to the eye. If more amount of light, it will constrict, it will become smaller. Less amount of light will pass. If it is darker, this pupil will dilate. More amount of light will enter. That's how you have to remember, right? Now remember, you have some structure somewhat like this. These are known as the ciliary body, right? And you have some finger-like projections here. I'll draw it again just to make you more clear, because if I draw everything in the one diagram, it will become very messy, right? Now just bear with me some more time. And you have the lens here. It's been suspended to the ciliary body by zonules. These are like band like structure which supports the lens. Now here comes the main parts now, right? You just draw just draw it. I'll tell you what is all this, right? One structure here, then that's all you have to draw. That's all, man. This is your sclera. What is a sclera? The white part of your eye, right? The white part that you see in the eye is the sclera. Remember, in the top layer of the sclera, we are having conjunctiva, which is also a transparent layer, right? This is the sclera. Inside is choroid. Inside this is retina, and this part, right, is actually vitreous humor. This is like jelly-like material, right? Now remember, from the cornea till the lens, right, you are having aqueous humor. You're having what? Aqueous humor. Remember, now some important points start to come in. I'll draw a structure here. You don't have to worry so much. Just I'll magnify everything and I'll let you know, right? So let us try to know this structure. What is this structure? Here where the optic nerves comes out. Okay, optic nerve. I think you have heard about optic nerve and optic disc. There's nothing, don't worry so much about optic nerve. Nothing, it's very simple. This is the magnified diagram of this. Okay, optic disc is the beginning of, right, optic disc is the beginning of the optic nerve. Like it's just a like hole where the optic nerve enters the eye, right? So what is this? This is the disc, this is the cup, and this is the fovea, right? Remember, what am I saying now here? Fovea, the center of macula is fovea. Around 80 to 90% of the light that enters to your eye is focused in the fovea, here in this part, in the fovea, right? And the best vision you see is in the fovea only. And this fovea is the most sensitive, like the most sensitive part of the retina. That's what you have to remember. Now remember the diameter of the fovea. Diameter of fovea is 1.5 mm, right? Same is the optic disc, is also 1.5 mm, right? And remember, distance between your optic disc and the fovea is around 3 to 4 mm, or 2 disc diameter, right? Distance. This is what you have to remember about that. This is very, very, very important, guys. You have to remember about this, right? So whenever we are talking about retina, now let us try to talk about the retina. Now we are talking about retina now. Whenever we are talking about retina, divide the retina into two parts: central and peripheral. Central and peripheral. Peripheral is known as ora serrata, and the central one is known as the macula, right? Center of macula is your fovea. Center of macula is your fovea, right? So if you see the eye, right, if you see the eye, what you're going to see here is somewhat like this. This is your optic cup and an optic disc, right? And your fovea, you'll see the vessels are somewhat like this, you'll see the vessels. You'll see the vessels, and this is your retina picture. That's what you have to remember. Now, this is what you have to understand here. Then the next thing that I want to tell you is that anterior segment and posterior segment. This is important, guys. Now, anterior segment is divided into anterior chamber, posterior chamber. What is anterior segment? All the structures in front of the lens is known as anterior chamber. From here to here is your anterior chamber. Anterior segment. From in front of the lens is your anterior segment, and the structures behind the lens is known as posterior segment. Now this anterior segment is divided into two parts: anterior chamber and your posterior chamber. Now, what is your anterior chamber? The space behind of cornea, in front of iris is known as anterior chamber, and the space behind the iris and in front of the lens is known as posterior chamber. So from here is your posterior chamber, this is your anterior chamber, and from here till here is your anterior segment, and structures behind the lens is known as the posterior segment. And how vitreous is filled here, this entire part, okay, this entire part, if I draw it like this, I'm sorry, but it becomes messy. This is actually containing your aqueous humor. Aqueous humor, it's a very, very important thing that you have to understand about the aqueous humor, because glaucoma is very much related with aqueous humor drainage, right? So that's what you have to remember. Now, for your more a bit detailed understanding, I would like to draw the ciliary body one more time. Whenever you draw the ciliary body, just draw it in such kind of fashion. It's like a sketch diagram, okay? What is this? This is like the folds, no? These are like your folds. Remember, plicata means folds, so this is known as pars plicata, and this part is known as pars plana. So pars plicae and pars plana are the parts of the ciliary body. This is your ciliary body. That's how that is the thing that you have to understand about your eye. And whenever you talk about the sclera, remember sclera makes around 5/6, and the cornea makes 1/6. Remember, cornea, you are not able to see it normally. It is the transparent layer. You cannot see it, right? If you're able to see the cornea, that means there's some problem, right? Why are you able to see the cornea? Cornea is very transparent. In fact, it's the most transparent structure in your entire body is your cornea. So cornea you're never able to see. So this is what you have to remember. Just to quick summarize, this is your cornea, right? Cornea. Inside the cornea you are having the iris. That is the color of the eye is actually the color of iris, not the color of cornea. You cannot see the color of cornea, right? And then you are having the ciliary body, and you're having the plicata, minimal folds here, some folds here. This is your pars plicata, this is your pars plana, and this lens has been suspended by some zonules, okay, suspensory ligaments. And then this is your lens, and from here you have the sclera, which is a tough membrane which gives integrity to the eye. After that you are having the choroid. It is also known as the middle layer, of course, between its middle between sclera and retina. That is the reason it's known as middle layer. It is your choroid is very vascular because it gives nutrition and blood supply. And then you have the retina, okay, it's the innermost important structure of the eye, right? That is an inner layer. So again, retina is divided into two parts, peripheral and central retina. Again, you have to remember the optic nerve, right? What you are saying, this optic cup and optic disc is, there's no actually in short I'll say there's no importance. It's just like a pathway to allow the optic nerve to go on, right? So remember this remember the ratio is 0.3 to 0.6, okay? Optic disc ratio, optic disc and optic cup ratio is your 0.3 to 0.6, right? So if this ratio is increased, then we will know that there's some maybe edema, maybe due to a glaucoma, disc changes have been there. So that is a different topic. This is just a basic understanding of the eye, and this is the cross section. Now if I want to tell you in very short about what you see from the eye, right? Imagine this is the nose. Again, there's an eye here. So this is your eye. Remember, the upper eyelid covers around 2 mm. It covers the cornea, okay? It covers around 2 mm of the cornea, right? So this will be your middle canthus. This will be your lateral canthus, and here you will have a small hole. Up hole is known as upper canaliculi, lower one is known as lower canaliculi. It means punctum, okay? And this is your cornea that you cannot see actually. Then you will have the iris, and then you will have the pupil, right? And this is the white part is your sclera, which is also covered with your conjunctiva, and the junction of conjunctiva and the cornea is called as the limbus. This area will be somewhat limbus. It is also known as the danger area of the eye, because if you have chemical injury in this eye, this area is very, very, very bad. This is what you have to remember. And here you will have the canaliculi, and that is lacrimal apparatus. We can discuss that in another topic. That is what about the basic anatomy of the eye that I wanted to talk. And if you have some suggestion, questions or something, I'll be happy to answer. And any questions, I'll be very much happy to answer, and also I'll try my best to answer. If I can't answer, I'll ask my teachers, seniors, books, okay? Not everyone knows everything. I am not God. I can make mistakes. For that reason, you have the comment section. Okay, that's all for now. Thank you for watching. I'll see you around.